Okay, so let us start this call and welcome to this informative briefing session on the All India COVID-19 trends and forecast analysis. And this analysis, before we start presenting the results and the trend that we have derived, I would like to just give you a background about this call and the way we have collected these results and the findings and the data behind it. So the official website of government, which releases the official data about COVID-19 cases, the daily cases, the daily deaths, and the daily recovery rates, or the numbers behind each recovery, and all these numbers for each and every state are being collected. And I will just now quickly do a screen share. So when I'll share my screen, I will request you all to just raise your voice if at all you are not able to see the screen. So I hope everyone is able to see the screen. Can anyone confirm?
Yes, we can.
Great, great. Okay, so as we can see, this is a large database started collecting since 5th of April. That is, right in terms of the first lockdown when it was started. And, it is related to all the states as well as the national data. As I'm just scrolling down to show the data behind each and every state, and every day this data was collected from the official government website. As we can see on my screen, this is the official Ministry of Health and Family Welfare Government of India website, which releases the daily data. Previously, they used to release this data twice a day. That was 5 p.m. in the evening and 5 a.m. in the morning. Then after, since the month of May, they had changed the timings and they decided to release it only once a day. And that was 8 a.m. in the morning. So as we can see, the national level figures are listed over here, and the state data, if you click on that, you can see the state level data for each and every states. And this data is getting refreshed every day. And so the database which I had collected over here, as you can see in the Excel sheet, is taken every day for each and every states. So I'm just quickly making a scroll on these state data. I will request all the participants to please be on mute unless you want to have a question, and we can also take the question session after this briefing. That is 5 minutes just before we end this briefing.
COVID-19
So I will request all the participants to please be on mute when you are not speaking. Okay, so all the 29 states that we have been tracking and monitoring the COVID-19 uh, cases since the government started reporting the numbers. We have maintained the database of all of that. And so now let's have a view of the what the graph looks like. So as we can see over here, it's a steep increasing graph. It's not an exponentially rising graph, and thank God that we had this lockdown much earlier implemented in India, which has actually helped us. to maintain a graph which is not exponentially growing, which is growing at pace, although not flattening or not a reducing graph, I would say. But yes, we have maintained a pace which is far better than most of the other developed nations and most of the other countries who had implemented lockdown measures, who had implemented social distancing and all of the measures. So as we can see on this graph, the orange line, the sapphire line, which you see, is the net active cases. So the net active cases started from around 2000 on the 5th of April, and they were, earlier also tracked. But this data is from 5th of April or 6th of April, you can say, to today, that is 17th of May. So we can see that it has grown from 2,000 somewhat number to 53,946, which is close to 54,000 today. And this number, 53,946, you can see right here on the government official website. It's the same number. So the active cases as on today is 53,946. And we can also see these below three lines, which map the net increase in the active cases. So what is the net increase, the rate of net increase in these active cases? And we can see that the graph line for the net increase, the yellow line, what you see over here, is close to 2,000, and then it has gone further to around 3,000, and then 3,500 to 4,000, and then now it is dropping. The net increase in inactive cases is dropping. Simultaneously, the better part is the green line, which you see is the recovery rate, and which is also increasing. It has started to increase since 26th of April. It has started to increase and tried to match the net active cases. And then today, in the last 2 days, we can see the recovery line is going above the net active case increase. And yes, the sum of deaths, it's the gray line, which is very low, which is at the bottom, as you can see in this graph. It is also a good thing, I'll say. Unfortunately, we have deaths. It is a sad part, but then we have lesser deaths, as you know, and as we can see from the news and every sources, that the deaths has been quite lower compared to other nations with such a big population, or even lesser population. We have lower number of deaths. The other part, now let's move on to a very granular level of analysis and the actual insight on how the COVID-19 trend is seen across India and amidst the lockdown measures. How is it looking? So let me first explain you the methodology of this graph. So the white dotted line, what you see over here, is the point zero. The point zero, we need to have when we talk about the rate of increase in the daily cases, or the rate of increase in the recovery number of cases of recovery, or when we say the rate of increase in the net active cases, we need to have some kind of benchmark, some kind of base number to compare it, to see what is the increase, the multiple of increase, what is the multiple of increase compared to that number. And so in order to have that base number, the best metric of comparison is taking the average of the gross increase in the daily number of cases. So the daily gross increase from 7th of April to the 17th of May. So from April to May, so from April to May, this entire range, what we can see these many days and these lockdown that we have been still following and practicing sitting at our homes. So this entire range, what was the average of the gross daily increase? So that average comes to 2,149, as you can see here, and that is taken as the point zero. So when we say that, okay, comparing this, the growth or the daily numbers of new cases, or the daily numbers of the active cases and the daily numbers of the recovery cases, comparing it with the average of this entire period, what does the graph look like? So as we can see initially, starting from 7th of April, initially when the first lockdown ended, the average of the daily new cases, what is abbreviated as the DNC, was 834 cases. So from 7th of April to, let's say, the 12th or the 13th of April, the average number was 834, and that is taken as X. So taking that as X, what is the multiple of X that we can see in the coming weeks that we have followed this lockdown? And it is unfortunate to see that the multiple of this X, that is the average in the first week or the last week of the first lockdown that ended as X, is now grown to 4.8 times. That is almost 5 times of the X, as we can see as on today. The average daily new cases is 4,007 from 11th of May to 17th of May. This is the average number of cases that we see. So now what does this make sense? How does this make a sense to us? Of course, we see that the multiple of X, what we see from the initial end week of the first lockdown, has grown to 4.8 times. But how reasonable is that? And what would have happened if we do not had implemented the lockdown? And what is the reason for this 5 times of increase that we see in the X? So let's take a rational thinking about this. We can see that initially this X multiplied by 1.4 times, and during the second lockdown, the first week, it came to 1,186 cases. So 1.4 times is as per ICMR research, which says that even if the person is quarantined, if one person is affected by this COVID-19 disease, and even if he's quarantined, if he is following all the social distancing measures, if he's following all the hygiene measures and everything, he's practicing the best part of himself to control this contagion and avoid spreading this disease. uh, it will lead to infecting 2.5 people. So one person will infect 2.5 people, even if he is following all these measures. So as we can see, this multiple has grown to 1.4 during the first week of second lockdown. It has gone to 1.8 in the second week of the lockdown. And in the last week of the second lockdown, we can see that multiple has gone to 2.5. So what is really the best part and the good part is that our lockdown has really helped us to avoid the spreading of this contagious disease until the second lockdown. However, as we can see, from the second lockdown, when the second lockdown ended, after that the ratio of the multiple has increased more than the safest benchmark of what the ICMR had said, like 2.5 people getting infected by one person. So we can see that even if we compare this to the developed nations like US or Italy and Spain, this ratio has gone into multiples of maybe 10 times, of the infections, and we, with a population of 1.3 billion, have still maintained a very good part of this infections controlled to 4.8 times across the nation. Now, uh, there are always spoilers, and we need to think about how this entire country, with a 4.8 multiple of the average infections from the point zero, is behaving, and which are the states that are not following the lead, or not following the best practices to reduce or to control these infections. Before moving to that, I would like to highlight the part where this entire contagion spreaded the most and started spreading the most. So as you can see, from the 23rd of April onwards, the gap from the average point zero between the gross new daily cases, you can see the blue line, the highlighted blue line, and the white dotted line, which is the point zero, started to increase. So from 23rd of April, the number of new cases that started coming in the country rose tremendously. And we know that in this week we have been seeing that cases are started to come from 3,500 daily to 4,000 plus cases across India. And the net active cases, the yellow highlighted line or the sapphire highlighted line that you see is the net active cases. Now, how this net active cases is calculated is it is the outcome of the gross new daily cases minus the recovered new cases and the deaths, the daily deaths. So what we get after that is the net active cases as on that day. So as on today, what we see that the net active cases have gone down below the average, and the recovery rates have gone up. So starting from 15th of May, 15th, 16th, and the 17th, we are seeing a very good sign of the recovery rates going up, and they are going drastically up, trying to match this daily new case number. As you can see, the gap here is is closing. So that is the best part, I'll say. And uh, what is also interesting is that as we know that our doctors, our medical system, our healthcare system, and everyone are doing a tremendous job. And I would like to thank, and I would like to share my gratitude to all of the doctors and all of the medical staff and the healthcare services people who are really helping us out to move this recovery rate green chart, the green line, over the average white dotted line, and trying to match to the gross daily case. And what will be an ideal scenario is that we see this blue line, the blue highlighted line, going steeply down, and the net active case going steeply down as it has already started going, and the green line going above the average line, and it should be on the top. That will be the ideal scenario that we perceive, and we wish that we get it very soon. And we have already started to see those signs. So now coming to the part where let's see, even after having a very well controlled increase, I'll say controlled increase in the number of new cases, what makes India lag behind, or what are the spoilers, or which are the states that are inhibiting or prohibiting the flattening of the curve. So let's take, I've taken the top five states, which includes Maharashtra, Tamil Nadu, Gujarat, Delhi, and Rajasthan. These are the top five states. I'll say the top five contributors who are the highest number of infection states. And these states contribute around 80% of the total COVID-19 infections across the country. So these, let's take a view of all these five states, how these five states are behaving, and what is the kind of trend in these five states. How does lockdown affect these states? So starting with Maharashtra, which is, as we all know, it is the highest number of COVID-19 infections state of India as of now. And what we see on the top of here is the plus sign in the green. What you see, the 23% is the recovery rate of Maharashtra. So as we see over here, the total number of cases as on 17th of May is 30,706. Out of that, 7,088 have recovered, which comes to around 23,000. So the recovery rate of Maharashtra so far has been 23%, which I believe is very low. and we should definitely aim somehow to increase the recovery rate for Maharashtra COVID-19 patients. And I humbly appeal to the government of Maharashtra and the medical and the healthcare ministry of Maharashtra to please consider the best measures to get this number up. So let us take a view of Maharashtra. How does Maharashtra look like, and how it have behaved during this lockdown, entire lockdown? How does the Maharashtrian trend looks like? So again, during the first lockdown when it ended in Maharashtra, it had only 169 average cases. The daily new cases in the in the last week of the first lockdown was 169, and taking that as an X, how much increase in terms of multiples have we seen in Maharashtra? So a very I'll say very different view from the national level view what we just saw, where the multiple of increase from the first lockdown was 4.8 times, and Maharashtra is showing 8.9 times, which is almost 9 times of the multiple of the first lockdown average that we see. And we can see that the recovery numbers, the green numbers, the numbers in the green line, what you see on the graph, those are the recovery numbers, and the orange ones are the died numbers, the people who have died. So we can see that the green numbers have really shown a good increase. However, it is still a very big gap in terms of the red numbers, what you see on the graph, the red line, which is now going into 1,500, close to 1,500 number, with the average number of 1,497 in the third lockdown when it ended on the 17th of May. Today, the average number is 1,497, and there have been some spikes which we can see on these dates, like the 5th of May, sorry, the 6th of May, and on the 11th of May, what we see the spikes, which are close to 2,000 new cases on a daily basis. So we can see that until the second lockdown, the first lockdown, and the first week of the second lockdown, the people of Maharashtra had maintained a good decorum for the lockdown, following the lockdown, adhering to the social distancing measures, staying at their homes, following all the hygiene measures and everything. But during the second lockdown, what it shows is that these measures, or the practicing of the lockdown was not well done, and that was the result what we see in the following weeks. From the second lockdown onwards, the second week, we can see the multiple has gradually increased, and then it has increased exponentially in the first week of the third lockdown, from 6.7 times compared to 169 cases during the first lockdown. It has gone to 6.7 times increase, and now to 9 times. Moving ahead to the second most infection state, which is Gujarat. So let's see how Gujarat has behaved. Although the number of cases in Gujarat is much lower than Maharashtra, it has shown a better recovery rate than Maharashtra, with 39% people recovered out of the total number, which is close to 11,000 infections till date in Gujarat. And again, a very similar trend to Maharashtra, where the multiple of the average increase compared to the first lockdown has gone to 9 times, close to 9 times, similar to Maharashtra. We can see how gradually the average number of daily new cases have increased from 52 to now close to 456 daily new cases in Gujarat. And what is more alarming is today, in the last 24 hours, we saw 1,057 new cases registered in Gujarat. Now, again, there has been a theory, or there has been a rationale behind this, which many people think that this increase in the daily new cases may be attributed to the increased testing. So because of increased testing, the daily new cases might show an increase. And so it is a good thing that when we have increased testing, we can have more infections caught up in the net, and we can then isolate those cases, and it will further prohibit the spread of these disease from spreading or infecting the other people. So it is a good sign if this increase is attributed to increased testing. However, if that is not the case, if the increase in the daily new cases is not attributed to the increased testing, then it is an alarming signal that these increase is maybe attributed to community transmission. And when we talk about community transmission, that is a more concerning stage of this disease, where the community transmission is really going to be more dangerous for everyone. So moving ahead to the next state, which is Tamil Nadu. Again, Tamil Nadu is one of the case, and it is a unique one where I loved the part where Tamil Nadu initially shown a decrease. They followed the lockdown and they followed all the measures very seriously, and they shown a 33% recovery of their cases, the total number of cases. As we can see, the multiple of X gone down, and the average cases dropped to 57.5 and 64 in the first and the second week of the second lockdown. But then after, I think the people did not follow the measures over there, and the numbers, as you can see, again increased exponentially, and again matched to the 8 times number what we saw in Maharashtra and Gujarat. The good sign in Tamil Nadu, what we saw in the last 2 days, is the recovery rates have really jumped much higher. So close to 940 people getting recovered in just one day, which is a very good sign. Moving ahead to Delhi, so we can see Delhi in terms of the graphical view is showing a much zigzag view of the daily new cases and the recovery rates. Trying to match those daily cases. Many times the spikes of the recovery rates, daily new recovered cases, and they have also shown a very low multiple of the average that they produced in the first lockdown. So as we can see, the average multiple was just 1.4 to then 2.5, quite aligned to the national average. When we saw the national average, we saw that while the lockdown 2 ended, the national average was 2.5, and then it increased to 4.1 and 4.8. So it is very much aligned to the national average, Delhi, what it shows. And also, hopefully, we can see that the recovery rates are trying to match now to the daily new cases. And 42% of the overall patients recovered. It's a better number than the other states, what we just saw with Maharashtra, Gujarat, and Tamil Nadu. Moving on to Rajasthan. Rajasthan is the best managed state in terms of the COVID-19, as what it shows, with a 57% recovery rate of the total infections. Again, we can see the infection number is very low as compared to all the earlier states, what we just saw, the top 5 states contributing to the COVID-19 overall infections. And it is showing that the average multiple increase from the first lockdown is gone to only 2.7 times when the third lockdown ended today. It is showing only a 2.7 times increase. And also we can see the spikes in the green line, the recovery rate spikes. We can see that they are trying to match these red line numbers, and the gap is very close. They're trying to match the new cases. And as we can see, the number of deaths are very low in terms of the daily numbers. What was also a cause of concern for Gujarat, I'll go back to Gujarat because the number of deaths, what we see here, with such number of infections is very higher. Even Tamil Nadu has close to 11,000 infections, but the number of deaths, what we see until date in Tamil Nadu, is only 74. Only 74 people have died, whereas as compared to that number with Gujarat, it is 625, which is really a concern, a cause of concern. As I just said, again, the cause of concern is also community transmission in Gujarat. So having said all this, now let's try to having seen all these states, let's try to see what is the summary view, what kind of projection are we looking at in the coming week. So we have taken the 5 weeks average growth rate, what we see here in these COVID-19 infections, the number of daily new cases. What is the weekly growth rate in the 5 weeks that we just saw? And that average of the weekly averages is coming to 38%. So if we see this number as on today, the 53,946 net active cases, and the new cases that have come today is 4,981. So what would be a safer measure if I would have taken the 53,946 number and then applied this 38% to that number to have this forecast figure? But what I did is I went ahead and included that new cases and added that number. So this number, irrespective of the new cases, what is the overall gross number of today, as on today, as on today, the daily, the total all India cases as on 17th of May, that is 58,927, and then applied that 38% to this, we can see that in the coming week, this number will go to 81,000 cases. This is close to the net active cases. Now, when you see in the news channels which say that the number is close to 90,000, that is not the active cases. This is the number of the active cases what we are forecasting, and we can see that number on 31st of May will be going to 1,12,000. Again, in 7th of June, on the 7th of June, it will go to 1,54,000, 2,13,000, 2,94,000, and close to 4 lakhs on 28th of June. Now, isn't this very dangerous, very scary number? It's looking very scary, right? But I know, let's take, there's another side to showing a good picture to you. Now, let's say, what about the recovery rates? If we see the recovery rates of the weeks that we saw, this is the recovery rates looking like. We have 104% recovery rate of the 5 weekly averages, the growth rates of these 5 weeks, the last 5 weeks that we have monitored, and the net and the rate of increase in the recovery rates is coming to 104%. Now, if I'm going to apply that 104% of the recovery rates to this number, the total recovered cases as on date today, that is 34,000, we are going to surpass that number in just second week of, in the last week of May. We are going to surpass that number of the infections. So we need to not to worry. But even if we say that, okay, this is still looking an exaggerated figure, this is still looking a very hyped figure. So let us take a safest assumption of 60% growth rate in the recovered cases. So if we say that the daily new cases which are getting recovered are growing at a pace of 60%. So what is the picture looking like? So even if we take that safest measure of 60%, not 104%, the number of recovery rates will match up to this number, okay? The 2,13,000 number, 2,13,000 cases in 14th of June, we are going to match up that number on 14th of June. Now, it is very imperative that what is in our hands, that by looking these numbers, okay, we say that by the 14th of June, 2,13,000 cases might be getting infected. and against that we'll have a recovery number of 2,23,000. So that's fine. I mean, we'll be overcoming the coronavirus by that time. So what is in our hands? Let's not be going by the numbers, and let's, in the interest of time, I'll just make a request that what is in our hands is follow these measures. So this was a free session. I know we are running out of time, and in the interest of time, it is very important that we follow these measures after looking at the projections. So all what we can do is just wear our mask, have the social distancing, and regularly wash our hands, sanitize, avoid touching our eyes, nose, and mouth, and follow all these measures. And then we'll definitely lead to a safer place for us to live in the coming days. So towards this end, I will just hold on, and I'll just request everyone for any queries or further information, or if you like to share something, you can just reach out to me on this email address. So okay, so I'll just rest my speech over here, and I'll just wait for your thoughts, your feedback. Hello.
This was amazing. We expect the cases turns out to be positive by the date that you have mentioned, and we soon start to emerge from this pandemic. It's
Thank
very
you.
informative, by the way.
Thank
You
you.
should do it one more time after the date that you have mentioned. The cases of recovery will surpass the infected ones.
Sure, sure.
We'll be very interested to see numbers heading out there.
Sure, sure, definitely. And I will
Thank,
really love
thank you.
to,
Hmm?
yeah, thank you very much. I really love to do a next briefing
Yeah.
very soon, and hopefully, what I will
Hmm.
say that let my projection be wrong, and let us see that if we surpass the increase in the daily new cases much earlier than that.
Hmm.
So,
Thank you so
I
much
would
for
like to
this
say this
informative
was
session, guys.
really a very informative session, and I really hope that whatever projections we have showed, it realize, and we get out of this very soon. And I assume that if in between, if we come out with a vaccine, then
yes,
it will be clear than what we are expecting right now.
great.
So it's a very great session, and I would say it's a really a very great initiative by someone who is actually looking into this and in informing others. Thank
Thank
you
you.
so much for that.
Thank you
Yeah.
very much, everyone, for taking out your valuable time. And it really inspires, and we really think that we can better serve our nation with whatever the best that we can do. And thank you very much again for giving your valuable time. And I will request all of you to spread positivity and spread this good news and the best part that we can do. Okay, so thank you very much, and
Thank you.
Jai
Thank
Hind,
you.
Thank
Jai
you.
Bharat, Jai Akhand Bharat, and hopefully we'll
Thank
come
you.
out of this very soon.
Jai Hind.
So
Thank you.
much.